Hey everyone, today we're going to be doing our project on gait in pregnant women. We chose this topic because we wanted to further research the question of how does pregnancy affect gait. We chose this for a few different reasons. We wanted to see if pregnancy affects gait, to see if gait in pregnant women causes back pain, and to determine what causes the pregnancy wobble. We hypothesized that pregnancy will have a prominent effect on gait due to an increased rotation about the body. Article 1, the pregnant waddle and evaluation of torso kinematics in pregnancy, examined the effects of late-term pregnancy on thoracic and pelvic kinematics resulting in gait changes, specifically looking at the phenomenon of the pregnancy waddle. The study began with 40 pregnant women. However, a few went into premature labor and others were injured, so they had to unfortunately drop out of the experiment, resulting in 29 only being able to collect data. 40 non-pregnant women who had never been pregnant or who had given birth in the past were selected for this experiment. All participants were aged 18 to 45, and those who were pregnant were considered to have a low risk pregnancy. All of the participants were brought to the lab and had markers placed all over their body to measure the movement about the thorax. Markers were placed on the sternum, the xiphoid process, the C7 and T10 vertebrae to measure movement at the pelvis. Markers are placed on the bilateral anterior and posterior superior iliac crests and the L4 vertebrae. And to measure step width, markers were placed on the posterior aspect of each heel. Participants were then instructed to walk down the 8-meter runway that was set up in the laboratory. They got to pick the speed that they were walking at. The runway was composed of 2 force plates used to record ground force reactions. An 8-camera motion capture system was also used to collect 3D kinematics of each subject. Some of these variables that were collected included frontal plane translation, step width, position of the thorax, and pelvis. The pregnant women came into the lab twice, once in the middle of their 2nd trimester and once in the middle of their 3rd trimester to have their data collected, and the control group only came into the lab once, and this was done 1 week following their menstrual cycle. An ANOVA was used to analyze some of the general information such as age, height, and walking velocity. A MANCOVA was used to analyze 3D kinematic variables such as frontal plane translation, step width, and position of the thorax and pelvis. The markers at the C7 and L4 vertebrae showed that there was a greater amount of frontal plane translation in the 3rd trimester when compared to the 2nd trimester and the control group. There was also a greater amount of step width in the 3rd trimester. Heel strike also showed that that the thorax was extended more during the 3rd trimester and that the pelvis was more anteriorly tilted during heel strike. Increased thoracic and pelvic movement during gait and pregnancy seems to lead to a larger step width, which may in turn lead to low back pain that many pregnant women experience. The data on the left-hand side shows the amount of frontal plane range of motion that was experienced during the gait cycle. It is shown here that the 3rd trimester showed the most amount of movement. On the right-hand side here, this data shows the sagittal plane movement. And of course, the 3rd trimester again showed the most amount. Does this support our hypothesis? Yes, pregnant women, especially those in their 3rd trimester, showed increased thoracic and pelvic movement during gait.
All right, so my article is Gait Analysis of Pregnant Patients with Lumbopelvic Pain Using Inertial Sensor. And the goal of the study was to investigate the relationship between lumbopelvic pain and gait characteristics such as symmetry, stability, and the degree of motion during pregnancy. So the participants were 52 pregnant women, and they were all aged either between 29 through 39 years old, and they all were in their third through 10th month of pregnancy. All right, so all the women were given a questionnaire, and then they were split up into 2 groups, the lumbopelvic pain group or the pain-free group. And then they wanted to further analyze the pain group, so they split them up into 5 subgroups, which is without lower back pain, only with lower back pain and sacroiliac joint pain, lower back pain and pubic symphysis pain, and then all of them together, so the lower back pain, sacroiliac joint pain, and the pubic symphysis pain. Right, so for their task, all they had to do was walk straight on a 14-meter walkway in the same style flat shoe while they were performing the task. So the data that was gathered, they measured the time across the middle 10 meters in meters per second on the walkway. And then when they gathered their data, they had an inertial measurement unit that was mounted onto a turntable to follow their gait pattern. They also wore a belt that had a sensor unit with a triaxial angular rate gyroscope and a linear accelerometer at the L3 spinous process. And then they also wore a pressure sensor on their heel while performing this task. And they only did one trial of that. Okay. So for the significant findings, there is motion asymmetry of both rotation and translation in the gait of the lumbopelvic pain group. And the degree of asymmetry for the roll angle of the lumbopelvic pain group was greater than the pain-free group with the p-value of 0.004. The degree of asymmetry for the roll angle of the lower back pain and sacroiliac joint pain was greater than the lower back pain, sacroiliac joint pain, and the pubic symphysis pain group, and their p-value was 0.016. And then here's just a table showing that the degree of asymmetry of the roll angle was greater in the pain group compared to the pain-free group in the little bolded letters there. So does this support our hypothesis? Yes, overall it does. There's an increased rotation about the front to back axis in the lumbopelvic pain group compared to the pain-free group. So this indicates that pregnancy does affect women's gait, and they may be experiencing more pain because of this increased rotation about the roll angle while they are walking.
Okay, my article was on the changes of kinematic gait parameters due to pregnancy. Prior research had shown that the effects of pregnancy on posture, however, when it came to gait, there was very little found. So the main goal of this study was to measure the selected gait parameters in one group of women in 3 different states: before pregnancy, during pregnancy, and after delivery, specifically half a year, and evaluate the differences in their way of locomotion. The recruitment of the participants took about 2.5 years with the help of a gynecologist alongside the research team. 13 healthy women with no previous orthopedic or neurological injuries were selected that were planning on having a child in the near future. So the methods were that the women participated in 3 different gait testing sessions: pre-pregnancy, during the 3rd trimester of pregnancy, and half a year postpartum. Reflective markers were placed on the women at each of the 3 sessions, and they were told to walk barefoot at their own desired comfortable speed for about 30 steps. The reflective markers were placed as such: 4 markers were placed on the head, 4 on the trunk, 3 on the pelvis, and 7 on each of the upper and lower limbs, for a sum of 39 markers. The parameters measured were velocity, gait frequency, length of steps, time of single and double support, range of motion of major joints in the lower limbs and sagittal plane, and calculated width of base of support during double support phase. So the resulting significant findings were that the ANOVA showed that the ranges of motion in the main joints in the lower limbs, aka the ankle, the knee, and the hip, during gait of women in all 3 phases were not significantly different. The speed and frequency of gait returned to pre-pregnancy stage about half a year after delivery, and many of these results are found due to weight increase during pregnancy and musculoskeletal changes seen. So as for the average length of steps, if you take a look at the graph, the only significant differences shown were between the pre-pregnancy stage at 0.75, the first bar on the left, and during pregnancy at 0.71 meters, the middle bar. Post-pregnancy at 0.74 meters stayed aligned with pre-pregnancy, showing that most parameters returned to pre-pregnancy stage about half a year after delivery. Does this support our hypothesis? Yes. So overall slower speed, lower length of steps, and lower frequency of gait was found in the postpartum group, which signifies an increase in rotation of body during pregnancy affecting gait patterns. So our summary is pregnancy does have an effect on gait. Pregnancy causes rotational changes in the thoracic and pelvic regions, and these rotational changes may be the cause of the back pain most pregnant women experience. In the future, we would like to investigate how long it takes for a pregnant woman's gait to return back to pre-pregnancy level.